Welcome to the Omnidental Podcast.
Hello, everyone.
We are diving deep today into what might be the single biggest hurdle for people considering dental implants,
I think I know what you're going to say.
the dreaded bone graft.
There it is.
You know, implants are just life-changing. I mean, they offer stability, permanence, and it's a world away from traditional dentures.
Oh, completely.
But the second a patient hears, well, you might need a graft, all that excitement just deflates.
It really does. It sounds like a major complication.
It signals extra cost, more surgery, more time. So for this deep dive, we're tackling that one big question. Can you actually skip the bone graft? Is it possible to bypass that step entirely?
And that's absolutely our mission today. We're going to look at the factors that, determine if it's necessary.
Okay.
We want to analyze the real benefits of skipping it, and it's more than just money. And really importantly, what a proper comprehensive assessment looks like.
And we're framing this conversation around a specific practice, right?
Yes, we're using OmniDental and MedSpa in Arlington Heights, Illinois as our context. They offer the whole spectrum of treatments, which gives us a really solid framework for this discussion.
Okay, perfect. So let's set the stage for everyone listening. OmniDental and MedSpa, they're located at 305 E Rand Road in Arlington Heights. And the practice is led by Dr. Bylas Poles, who has, more than a decade of experience?
That's right. Over a decade in general, cosmetic and preventative dentistry.
And I think that's so relevant. When you're making a huge decision like whether to get a graft, that level of experience, it really matters.
It's critical. And what's interesting is the sheer range of their services. It's not just your standard dental checkup.
Right.
They're handling really complex treatments. We're talking full arch dental implants, all on 4 procedures, and of course the support structures for those like bone grafting and root canals.
And then there's the MedSpa part. I think some people might see that and think it's separate.
Exactly, but it's not. It's completely integrated. It signals this holistic approach to both function and, importantly, aesthetics.
So when you see services like Botox or microneedling alongside dental implants, what's the connection there?
The connection is the face itself. They're not treating teeth in a vacuum. They understand that the success of an implant, the health of the jawbone, directly impacts your overall facial structure, your symmetry, how you age.
Ah, I see. So it's all one big picture.
It is. For listeners in the area, Buffalo Grove, Palatine, Schaumburg, it means you're getting one comprehensive plan that considers everything.
That makes a lot of sense. The jawbone is literally the foundation for the lower third of your face.
Precisely. Which brings us right back to the obstacle, the bone graft itself.
Okay, let's tackle that hurdle head on. Before we talk about getting around it, what is bone grafting? Why is it even on the table in the first place?
Well, put simply, bone grafting is a surgical procedure. Its goal is to rebuild or add volume and density to your existing jawbone.
And why would someone need that?
It's usually needed because of significant bone loss. We call it jawbone atrophy. This can be from age and injury or, probably most commonly, from long-term gum disease.
So if I'm picturing this right, the implant is like a screw, a titanium root.
Good analogy.
For that screw to hold, it needs something solid to go into. It has to actually fuse with the bone.
And that's the key term, osseointegration.
Osseointegration, okay.
It's a chemical and structural bond between the titanium and your living bone. If the bone is too thin or too soft, if it doesn't have enough height or width, the implant just won't be stable.
So trying to place one anyway would just...
It would lead to failure, almost guaranteed. You need that solid foundation to handle the forces of chewing for, years and years to come.
So it's not a preference, it's a mechanical necessity. You're shoring up the foundation.
Exactly.
What kind of materials are we talking about here? That seems like it adds another layer of complexity.
It does. There's a whole spectrum of materials. The gold standard is often what's called an autograft.
An autograft?
That's where we use the patient's own bone. It's usually harvested from another spot, like the chin or even the hip.
Your own bone. Wow, that sounds pretty intense.
It has the highest success rate because your body recognizes it. There's no rejection.
Are there less invasive options?
Oh, yes. For smaller defects, dentists can use an allograft, which is processed human donor bone, or even a xenograft, which comes from a bovine source.
So an animal source.
Right. And those materials act more like a scaffold. They create a framework that encourages your own body to grow new bone cells into that space.
I see. And this whole process, the materials, the surgery, the healing, that's why the cost and the timeline balloon so much.
That's it, exactly. I mean, that's why patients are so motivated to find an alternative.
Yeah.
You're talking about two separate surgeries.
True.
Yes. First, the graft, Then you have to heal for anywhere from 4 to sometimes 9 months, and only then can you even think about placing the implant.
It's a huge delay.
It's a major pause in the process. You go from what could be a single procedure to a multi-month commitment.
All right, so let's get to the good news. Let's define the conditions where you can avoid all that.
This is the aha moment.
This is what everyone wants to hear. When can you skip it?
It all comes down to measurable anatomy. The single most important factor is having sufficient existing bone. The volume and the density have to be there already to support the implant directly.
And sufficient is a clinical term, not just a guess.
Oh, absolutely. We're talking about the exact height, width, and quality of bone needed for the specific size of implant being used.
So if someone, say, just had a tooth removed recently, and their jaw is otherwise healthy, they might be a candidate for what's called immediate placement.
That is the ideal scenario, immediate placement. If the bone is strong enough to give the implant what we call primary stability right away.
Primary stability.
Meaning it's rock solid from the moment it's placed. If you have that, you can bypass the entire grafting process. The implant goes straight in, and you start that osseointegration process immediately.
Okay, but let me play devil's advocate here for the anxious patient. What if I'm borderline? I almost have enough bone. Can I just ask the dentist to use a slightly smaller implant or, just try it anyway? What's the real risk?
That's a great question, and it really highlights why the assessment is so critical. It's non-negotiable.
Mm-hmm.
If you force an implant into compromised bone, you lose that primary stability. The implant will have tiny little movements, micro movements,
Right.
and that prevents osseointegration.
So it never fuses with the bone.
Correct. Instead of bonding, it gets wrapped in soft tissue, and that means pain, inflammation, and eventual failure. You'll have to have it removed.
So the goal isn't just to get the implant in. It's to make sure it stays there for 20, 30 years.
That's the only goal that matters, long-term success.
Which puts the assessment into sharp focus.
Oh.
Okay, so let's detail the benefits again, because if you can skip the graft, they are really compelling.
They are. They're highly motivating. First and foremost, a dramatically shorter recovery time. Instead of a 6 to 9 month healing period just for the graft, you jump right into the normal 3 to 6 month implant healing. You get your final tooth so much faster.
And the cost. You have to talk about the cost difference.
It's substantial. Bone grafting is its own major surgical procedure. There are material costs, surgical fees. Eliminating that step removes a huge chunk from the total expense.
And just physically, it must feel less intense for the patient.
Oh, absolutely. It's a far less invasive process overall that translates directly to less post-op discomfort, less swelling.
Yeah.
It's just an easier, faster healing process. It's a win-win-win on time, on cost, and on comfort.
So what about the people in the middle? Maybe they've lost a fair bit of bone, but they really want to avoid a massive block graft. Are there any specialized alternatives?
Yes, and this is where advanced practices really shine. For patients with, say, severe bone loss in the upper jaw, traditional implants are sometimes impossible without huge reconstruction.
Okay.
But there are other techniques. The sources point specifically to something called zygomatic implants.
Zygomatic. Okay, you have to break that down for us. What is that?
So zygomatic implants are much longer than standard implants. They completely bypass the deficient upper jawbone.
They bypass it.
And they anchor directly into the zygoma,
Which is
the cheekbone.
The cheekbone. Wow.
It's a very dense, stable bone structure. Now, this is a highly complex procedure. It requires a lot of surgical skill, but it is a total game changer for those patients.
Because they can get a full set of teeth without waiting for a graft to heal.
Exactly. They can often get a fixed, full arch of teeth without those preparatory months of waiting.
So anchoring into the cheekbone, that sounds,
Yeah.
is the recovery for the patient a lot different?
While the surgery itself is more complex for the surgeon, for the patient, it's often a single procedure that allows for immediate function.
So they can use their teeth right away.
In many cases, yes. So they skip that long staged waiting time. It's a very specialized path, but it exists for cases where traditional grafting just isn't a viable option.
And this just brings us right back to the assessment process, doesn't it?
It all comes back to it.
You can't just walk in and say, I want zygomatic implants. This decision is based entirely on the diagnostic.
Absolutely. 100%. The decision to skip a graft or to use an alternative like that is never, ever guesswork. It starts with a comprehensive assessment of bone density, jaw structure, and your overall oral health.
And we're not talking about a basic flat X-ray here, are we?
No, not at all. This requires three-dimensional imaging, specifically a cone beam computed tomography scan, a CBCT.
A CBCT scan.
Yes. That's the essential tool. It allows the clinician to see and measure the jaw in all 3 dimensions, down to a fraction of a millimeter.
So they can see the exact depth and width of the bone available.
Exactly. They can digitally plan the entire surgery, the angle, the size of the implant, before they even start. Without that 3D data, you are flying blind.
So that level of precision means that if a practitioner like Dr. Poles says you can skip the graft, it's not a guess. It's based on hard data.
It's based on data that confirms you have the stability needed for that long-term osseointegration.
The assessment dictates the path.
Correct. A truly patient-centered approach means guiding you to the plan that maximizes your long-term health. If your bone is ready, fantastic, you save time and money. If it's not, then the graft isn't an obstacle. It's an investment in the success of the entire treatment.
Okay, so let's tie this all together for you, the listener. What's the main takeaway from all this?
I think it's pretty clear.
Getting dental implants without a bone graft is absolutely possible. It happens all the time. But, and this is the big non-negotiable but, it requires that your jawbone density is sufficient.
And your overall oral health is good.
And the only way to know that for sure is a thorough, personalized evaluation with advanced 3D imaging. It's an assessment, not a choice you make on your own.
And if I can, let me leave you with one final thought on this.
Please.
We tend to think about implants as just replacing teeth, but I want you to consider how the health of your jawbone, which is what this is all about, impacts your entire facial structure. Over time, bone loss doesn't just happen inside your mouth. It can cause the lower part of your face to get that sunken, collapsed look, which ages you prematurely.
Right, I've seen that.
So, successful implants and bone preservation.
Yeah.
It's not just about being able to chew an apple. It's fundamentally about maintaining the structural integrity of your face for decades to come.
That's a really powerful way to look at it. The foundation of your teeth is the foundation of your face.
It really is.
Well, for those of you who want that personalized consultation, who want to find out your quickest, safest path to dental implants, you can contact OmniDental in Arlington Heights.
That's the next step.
Give them a call at 847-483-8833. Or you can schedule your appointment online to start that conversation and get your bone density properly evaluated.
Great talking today.
We really appreciate you diving deep with us.